8:35 now on your Thursday. After skin cancer, prostate cancer is the most diagnosed cancer in Arizona and the second cause of cancer deaths in men. The local nonprofit Prostate On-Site Project says more than 4,000 Arizona men will be diagnosed this year alone. September is dedicated to raising awareness about prostate cancer and educating men on the importance of getting screened. So let's bring in Dr. John Oertle, Chief Medical Director at Envita Medical Centers. Doctor, great to see you again. Thanks for being here.
Great to be here, Jamie.
Reading off some of those numbers, prostate cancer is a serious business. Tell me about the screening that makes people hesitant.
Yeah, it's the #1 diagnosed cancer in men, but it's also the second leading cause of death. And so you want to be able to get screened early. It shouldn't be a death sentence. That's the biggest thing. And if you get screened early, it's usually your age. The older men are, the more at risk they are of developing or finding prostate cancer. But you should get screened at 40 years old, because if you start your screening at 40, you can catch it early and it shouldn't be causing any death.
Okay, there is a hesitancy around it when it comes to the screening. Why is that?
Yeah,
can you put people at ease about this?
Yeah, it's a little uncomfortable for a man. It's, private parts and it's a physical exam. But
Awkward.
there's also, it's awkward, but you should do it. It's life-saving. It actually is not as bad as a lot of men make it out to be.
Yeah.
But the blood test is great. It's a PSA. It's called PSA. It's a simple blood test that can be a screening to be able to see, should you do further investigative testing to evaluate, do you have cancer or not?
And you can even look into genetic preconditions, possibly.
Yeah, so there's a lot of things that you can do to be able to protect yourself against prostate cancer. Like, again, risk factors. Obesity is a risk factor to prostate cancer. So being able to stay in weight, being able to get 10,000 steps in a day and make sure you're moving as a man can all help reduce risk. But also one of the things that actually is found is that there's genetics that play a role, and many men, when they get diagnosed, are told, well, you're going to die of cardiovascular disease maybe before you die of this prostate cancer, because a lot of them are slow growing, but there is genetics at play that actually make it that some prostate cancers are really aggressive and should be treated seriously.
And
so you can evaluate this. Well, so the data actually shows that black men have actually higher risks of having more aggressive cancers, increased spread to the bones and metastases, and they actually have a 2 times increased risk of dying from prostate cancer. So, and all men can, but it's really important that once you're diagnosed, that you do have an evaluation through genetic testing and precision medicine to be able to make sure that you're able to actually understand what kind of prostate cancer you have and the best way to be able to treat it.
What are those treatments?
Yeah, so we have a lot. One, again, you can get surgical removal of the prostate. I don't usually recommend that because it comes with a lot of side effects, even with the new robotics. But what I do is, again, we do a lot of, non-invasive treatments of treating prostate cancer and looking at genetic targets to be able to treat our cancers. And so we do a lot of that to be able to make sure that you have less side effects and the best outcomes.
Yeah, so go ahead and look into the camera and tell the people why they should go get screened and checked. This is the month to do it.
This is Prostate Cancer Awareness Month. It's really important. Let's get checked for prostate cancer. Get in to see your doctor, do physical exam, and get a PSA and start the screening process. If you have cancer, prostate cancer at any stage, contact us at Envita to be able to make sure that you're getting the right treatment.
Yeah, do it for those you love.
That's right.
Doctor, great to see you. Thanks for coming to discuss this with us.